Pregnancies complicated by diabetes have increased risk of congenital anomalies. Good glycemic control improves pregnancy outcomes, but does not eliminate all risks. Malformation risk is closely related to blood glucose levels before conception. Ideal fasting blood glucose during pregnancy is 60 to 100 milligrams per deciliter. 1 hour postprandial blood glucose should be between 100 and 140 milligrams per deciliter. Hemoglobin A1c should be maintained below 6% before and during pregnancy. Oligohydramnios is defined as reduced amniotic fluid volume for gestational age. Most cases of oligohydramnios are idiopathic, but known causes exist. Uteroplacental insufficiency can cause oligohydramnios. Ruptured membranes can cause oligohydramnios. Maternal medications may reduce amniotic fluid. Chromosomal abnormalities can be associated with oligohydramnios. Renal and urinary tract anomalies in the fetus are major causes of oligohydramnios. Potter syndrome results from prolonged severe oligohydramnios due to kidney disease. Compression in utero from low fluid restricts fetal movement and causes lung hypoplasia. Classic findings in Potter syndrome include lung hypoplasia, growth restriction, and facial flattening. Facial features include flattened nose, low-set ears, and small jaw. Limb deformities such as club hands and feet or joint contractures are common. Bilateral renal agenesis is the primary cause of classic Potter syndrome. Potter syndrome usually leads to death soon after birth from lung hypoplasia. Other causes of Potter-like sequence include early membrane rupture and anhydramnios. Fundal height measurement is a simple screening tool for intrauterine growth restriction. Fundal height is measured from the top of the uterus to the symphysis pubis. Before 20 weeks of gestation, fetal growth is relatively uniform. Ultrasound at 18 to 20 weeks is used to confirm gestational age based on fetal size. After 20 weeks, fetal growth varies more, reducing accuracy of ultrasound for dating. 4 measurements are used in ultrasound: biparietal diameter, head circumference, abdominal circumference, and femur length. Level 2 ultrasound provides detailed assessment for fetal structural anomalies. Abnormalities found on ultrasound may lead to amniocentesis for karyotyping. Non-stress testing evaluates fetal heart rate in response to fetal movement. A reactive non-stress test has 2 heart rate accelerations within 20 minutes. A reactive test predicts 99% fetal survival for at least 1 week. A non-reactive test is associated with poor outcomes in 20% of cases. A non-reactive test may also occur if the fetus is sleeping. Further assessment is needed after a non-reactive test, such as biophysical profile or contraction stress test. Biophysical profile includes 5 components: fetal movement, fetal tone, fetal reactivity, fetal breathing, and amniotic fluid volume. Each component is scored 0 to 2 for a total possible score of 10. A score of 4 or lower may require urgent delivery. A modified biophysical profile includes the non-stress test and amniotic fluid index. Amniotic fluid index is measured in 4 quadrants of the uterus using ultrasound. Normal amniotic fluid index is between 5.1 and 24 centimeters. Amniotic fluid index below 5.1 centimeters is oligohydramnios. Amniotic fluid index of 24 centimeters or more is polyhydramnios. Contraction stress test monitors fetal heart rate response to uterine contractions. Contractions are stimulated by breast stimulation or oxytocin. 3 contractions lasting at least 1 minute are needed in a 10-minute window. A normal contraction stress test indicates the fetus can tolerate labor.